Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Friday, the 12th of June. First up, I'll look at the numbers. In just the last 24 hours, the number of new cases is 11,199. And the total number of deaths that have taken place in India stands at 8,498. And that actually is our top story. What does the fatality rate or the number of deaths that have taken place here in India say about where we stand when it comes to the cases trajectory or the pandemic and how it's progressing across the country? Well, just a third of the entire number of deaths that have taken place in the first 10 days of June. It just gives us an idea as to how the disease spread is just becoming a little worse and increasing in these few days. As we've said, we are yet to hit the peak when it comes to COVID-19. So in the beginning of June, say the 1st of June, the total number of deaths that took place on that particular day in daily deaths went from 221 to 359 on the 10th of June. So just look at how the daily death count has also increased very rapidly in the last 10 days. In fact, the capital's death toll has now crossed 1,000 deaths, and the political fight that has started is that the civic corporation is saying that the actual number of deaths that have taken place here in the capital is double that number. They're also pointing out that from a really low fatality rate here in Delhi of 1%, it is now higher than the national average at 3%, because the national death rate, that is the number of people who get COVID-19 and those of them who die, is 2.9%. So Delhi now has a higher death rate. So this is why we have to be very, very careful, because it is getting worse. And it's not just Delhi. Even the numbers in Tamil Nadu, which also had a low death rate, are becoming suspect, and this concern has emerged after they found 235 unaccounted deaths. Now, while the chief minister has emphasized that they don't want to hide any of the numbers, and they've now set up a panel which is going to look at the number of deaths and come to where the truth is, whistleblowers are pointing out and saying that the government's explanation that there has been miscommunication doesn't account for the number of deaths and these unaccounted 235 deaths that were unaccounted for. Now, speaking of which, 69 districts across the country have been identified as ones which have a much higher fatality rate than the rest of the country. As I said, across the country, it's 2.9%, but there are 69 districts which have 5% fatality rate, which is much closer to the global fatality rate of about 6% or a little more than that. And these districts, these 69 districts, are spread across, majority of them are in Madhya Pradesh, then they're in Uttar Pradesh, Gujarat, Rajasthan, Telangana, and some parts of Delhi as well, in Shadra. Those are the districts which have a much higher fatality rate. So the central government health authorities are telling the district officials that they need to concentrate on paying much greater attention to those that are vulnerable over there who get COVID-19, that is the aged, and those with comorbidities, meaning that they have hypertension, heart condition. They need to pay much greater attention to them so that this death rate, higher death rate of 5%, comes down. The good news, of course, is in the form of the Sero survey that has been done in 86 districts across the country. Now, this was done in April, and it shows the antibodies that are present in the general population. It was only done among 26,000 respondents. However, authorities point out that it does show that if antibodies are present in less than 1%, that is 0.73% of the population, that means the majority of the population isn't impacted, and that even in rural areas the spread is very, very less. And that is the good news, that it's concentrated in urban crowded areas, and that is a trend that is across the world as well. So you see places like Delhi, Mumbai being impacted, just like New York is in America. The bad side and the downside to this is that we are very far away from seeing herd immunity. That means most of us are still vulnerable to COVID-19. So those are the news updates for now. Keep tracking them on hindustantimes.com.